Hello, I'm Dina Guda, and I'm one of our Spanish language interpreters here at Nebraska Medicine. As part of our commitment to extraordinary patient care, and as required by the American Disabilities Act, we provide an on-demand interpretive services for any patient who may need it. Under the law, we must ensure the patient and their family receives medical information in their own language. This service is offered at no charge to the patient. Spanish is the language spoken by the largest minority in Omaha, and to better serve these patients, we have 8 Spanish interpreters on staff, Monday through Friday from 6 a.m. to 6 p.m., and on the weekends, 1 interpreter is available from 8 a.m. to 4:30 p.m. We are also partnered with a language service provider whose interpreters are available 24 hours a day for phone and video interpretation on demand. We recommend you use interpretive services by video when it's necessary to perform a demonstration or in situations where it is helpful for the interpreter to see inside the patient's room. In critical situations where an interpreter is needed in person, please page 402-888-0646. For non-urgent requests or questions, please email us at interpretiveservices@nebraskamed.com. Our interpreters also translate the after-visit summaries for Spanish-speaking patients who are being discharged from the hospital. If you have a Spanish-speaking patient, you can request their AVS to be translated by sending a VoLTE message to the lead interpreter or the dispatcher. Also keep in mind, sometimes you'll have a patient who speaks English, but the family members who need the discharge instructions do not. For patients who are deaf, we have 8 sign language interpreters available. Under the law, we must have a computer with video capability at the bedside at all times for an inpatient who is deaf. Clinics must submit a request for a sign language interpreter in advance. If an interpreter is not available, the clinic staff must inform the patient and give them the option to use our video services or reschedule their appointment. For future cancellations, please email us, and for same-day cancellations, please page Nebraska Medicine Interpretive Services at 402-888-0646. Nebraska Medicine also contracts with a language service provider for all languages. This is a great resource when you're caring for a patient who does not speak English or Spanish, or when our Spanish staff interpreters are not available. Please call 402-559-8697 and follow the prompts to reach an interpreter on demand, or go on the Now for information of how to get an on-demand video interpreter. In one chart, you'll find a sticky note inside the medical records of patients with limited English language proficiency that details how to reach an interpreter on demand. Patient decides they want a family or friend to interpret, you must have the patient sign a waiver. The waiver form must be read aloud to the patient in their language, either by one of our interpreters or through our service provider. Please remember, a patient's family member or friend cannot read the waiver form to the patient. Be sure to document the name of the interpreter, their ID number, and their organization on the waiver form. This is a requirement. Please provide a copy of the waiver to the patient. A waiver form can be signed for a series of appointments as long as the person interpreting for the patient is the same person and 19 years or older. We also offer voice amplification devices for people who are hard of hearing. This device allows the patient to use volume control on a device that looks similar to a Walkman. It allows the patient to hear the clinical staff without the need for the staff to raise their voices. Contact our department if you need one of those devices. I hope this information has been helpful to you. If you have any questions, please feel free to reach out to our office.